Did you know that 15% of pregnancies often end in miscarriage? That might seem like a high number, that might seem like a low number, depending on your perspective. Hi, I'm Amy Vander Linden here at Moment of Truth Physical Therapy, and today we're going to talk a little bit about fertility and the role of pelvic physical therapy in that. So I want to clear something up really quick. First of all, when we talk about fertility and pregnancy, there is whether or not you can get pregnant, right? And so 12% of women have issues with getting pregnant. Then there's where miscarriage comes in. 10 to 15% of women, it's shown, have issues where they end up miscarrying. So both of those are likely to be vastly underreported. And part of that is that most insurance companies won't even discuss testing, won't even look into other issues related to miscarriages or fertility issues until you've had 2 miscarriages. So a lot of miscarriages also happen very early in pregnancy. And so sometimes women aren't even sure that they're pregnant or aware that they miscarried. There's a lot of factors that go into that, right? So today we just want to focus on some of the things that we can do to help with pelvic physical therapy and manual therapy that we specialize in. So again, related to both of those pieces, there's structural issues, but then there can also be hormonal and genetic. So here with our physical therapy services, we focus on the structural issues and helping to remove any barriers. That can be around the ovaries, the fallopian tubes, within the uterus itself, generalized scar tissue or inflammation that might be present. Unfortunately, a lot of women are told that if they have endometriosis or PCOS, which is polycystic ovarian syndrome, irregular cycles, they're left without a lot of resources or information. And if you've followed us for even 5 minutes, you guys know that I'm happy to jump on a soapbox or go on a rant about educating women and them knowing about their options, knowing their own body, and knowing resources. So there's a big longitudinal study. If you want the research, reach out and I'll get that to you guys. But they did a 10-year study looking at women and proven without a shadow of a doubt that manual physical therapy can help greatly, even with some of those more significant diagnoses that women are given. And they're often not given much hope. So here at Moment of Truth, we really focus on removing all of those structural barriers. We use fascial work and visceral work to try to make sure that your body has good circulation, the cells can talk to each other, and that there's good circulation and flow. This often results in better cycles, more regularity, less severity of cramping and bleeding or clotting. And then of course too, the work that we do greatly reduces inflammation. And inflammation can result in a lot of those issues presenting themselves. And of course, our body does not do well when our inflammatory levels are high. So we really try to help out by reducing those structural restrictions, bringing those inflammatory levels down, calming that nervous system, and really helping remove as many barriers we can for a healthy and happy pregnancy. Thanks so much for watching. I hope you found this helpful. Again, if you want any of that actual data or research, I'm happy to get that for you. Head over to our website. We've got a lot more resources there as well, including a blog post on this issue. Thanks so much. Bye-bye.